Gross and microscopic examination of irreversible injury. First is coagulative necrosis. Coagulative necrosis is caused by ischemia or infarction. In this type of the necrosis, the architecture of dead tissue is preserved for at least some days. Here the section of the heart wall which shows the coagulative necrosis, which is pale segment of tissue contrasting against the surrounding well vascularized tissue. In microscopic examination of coagulative necrosis, cells appears to have same outline but no nuclei. The nucleus is lost and there is the cytoplasmic hypereosinophilia, which is seen in the marked area in this picture. Second is liquefactive necrosis. Liquefactive necrosis is the transformation of the tissue into the liquid viscous mass. Often it is associated with the bacterial or fungal infection, like in the liver abscess. Here is the section of brain which shows the necrotic area, which is soft with liquefied center containing the necrotic debris. In microscopic examination, here the left area shows the liquefactive necrosis, and in the right area there is the many macrophage which cleaning up the necrotic cellular debris. Third is the caseous necrosis. Here is the specimen of tuberculosis of lung which shows the caseous necrosis, which is cheesy tan to white in appearance. In the microscopic examination of caseous necrosis, there is a central areas of necrosis around which there is a zone of epithelioid cells, and around the zone of the epithelioid cells there is the mononuclear cell infiltration. Sometimes there is the Langerhans giant cells are also seen in the caseous necrosis. Fat necrosis. Fat necrosis is the focal areas of fat destruction resulting from the release of the activated lipase. Here the specimen of pancreas which shows the areas of white chalky deposits represent the foci of fat necrosis with the calcium soft formation due to the lipid breakdown. In the microscopic examination of fat necrosis, the necrotic area contains the shadowy outline of necrotic fat cells around which there is an inflammatory reaction. Here some viable fat cells and viable pancreatic parenchyma is also seen. Fifth is the fibrinoid necrosis. Fibrinoid necrosis is the cell death that occurs when antigen antibody complex are deposited in the wall of the blood vessels along with the fibrin. Here the fibrinoid necrosis is seen around the blood vessels.